Thank you for the opportunity. I am Zalika Benton, a registered nurse with Novant Health, and I'm here, and I'm honored and grateful to be here. What a partnership between La Noticia and I'm excited to be a part of LatainaCon. I'm here on behalf of Dr. Ophelia Garman-Brown, who is the Senior Vice President of Novant Health Community Wellness and Community Partnerships, and she was unable to be here today. And also Mark Martin, who is here today, he's in the back, who is with senior leadership as well, and project manager of the Remarkable You program. And you may have seen a lot of the materials around in regards to Remarkable You, and I wanted to talk to you for just a few minutes about that. Remarkable You was designed with the goal of showing the community that we want to be there for you, and we want to come to where you are, and in regards to your healthcare needs. And another thing, I'm a very visual person. The thing that's wonderful about cell phones is they allow me to view my notes, so I'm not avoiding looking at you, but I wanted to make sure that I point out all the things that, that are important today in regards to what we're accomplishing. And the main thing is in healthcare is it has taken a shift from what we consider episodic care to more prevention and wellness. So what that means is that we're focusing more on ways to keep you out of the hospital, and taking a look at risks and discovering what those risks are and helping you reduce those risks that are associated with diabetes. Now, if you have a moment to take a look at the back of your program, it does have an outline of the focus around the Remarkable You program. And when we think about prevention, we're looking at those things that doesn't necessarily mean that you have a chronic condition, but that you have a very high risk for developing those complications associated with those risks. And these are the three areas that are focused through Remarkable You. The first one is A1C. And we have a group of panelists today that are going to do a presentation around diabetes, so they'll speak more to that, but I wanted to just kind of give you a quick overview about A1C and what that means. I am a diabetes educator, so I like to use a lot of metaphors to kind of help people connect the dots and understand what I'm trying to present. So an A1C, now how many of you have had your finger pricked? A lot of ladies you may have before, and it's not very comfortable. But that gives you so much knowledge and so much power in regards to your overall health. And in A1C, whenever you get your finger pricked and they give you a blood sugar count, I like to think of that as a little like wallet-sized picture. You know how when we were in school and you'd have to smile and they'd take a picture, and then you buy a package, you'd have those little tiny wallet-sized photos. That is what we consider like a snapshot, what your blood sugar is at that moment. But an A1C is more like that 11 by 14. It gives you a bigger picture in regards to what your blood sugars have been doing over about 3 months. And this particular A1C is not what we considered high enough to be diagnosed with diabetes, but it does mean that you do have a risk. And again, that's the focus behind Remarkable You, is to reduce those risks. Blood pressure of 130 over 85 is not ideal. 120 over 80 or less is where we'd like to see that blood pressure. And again, it's not much higher than 120 over 80. However, our goal is to get it as close to a normal range so that you reduce those risks. And the BMI. The BMI stands for Body Mass Index, and it is a guide that we use in healthcare to help us understand what the ratio is of your weight and how tall you are, and it affects again, the risks that are associated with things like diabetes. So the focus behind Remarkable You is to reduce these risks and focus on prevention, and we're doing so out in the community. Also, in regards to reducing these risks, you do combat the opportunity to develop things like heart disease, stroke, blindness, kidney disease, and all the things that are associated with diabetes, and that is our goal. They are conducting screenings today between, I believe the time is 2 and 5. If everyone has an opportunity to go by the tables and have the screenings, and they have other events that are going on at the time. So on behalf of Novant Health, I would again like to say thank you for allowing me to come and be a part of the program of LatainaCon, and I hope that you enjoy the rest of your day. Thank you so much.